getting vaccine into arms, like I said, as fast as we can. Virginia has been a leader among states in getting people vaccinated, and we will keep that trend up. This week, there are about 220 vaccination events around the state. So third, let's look at the numbers at our new call center. Last week, we launched a new statewide pre-registration system so that any Virginian can sign up online at vaccinate.virginia.gov or by calling 877-VAX-INVA. Since that launched, almost 500,000 Virginians have pre-registered. This is great news. The system is working, and it is meeting a much-needed effort. That is on top of 1.2 million Virginians who had previously signed up with their local health department. So we have 1.7 million Virginians now pre-registered. And the call center has received more than 100,000 calls so far. And as I said last week, the call center is in English and Spanish, and we have a callback program that covers about 100 different languages. If you're one of those folks who pre-registered through your local health department, you don't need to sign up again. You can check your status at vaccinate.virginia.gov. And if you have questions, again, you can call 877-VAX-IN-VA or 877-829-4682. Now, let's talk a little bit about where these shots are available. I mentioned that the Biden administration boosted vaccine allocations last week. They also increased the number of vaccine doses going to pharmacies in the federal pharmacy partnership. That means more pharmacies are coming online this week to start giving shots through that federal partnership. CVS started vaccinating Virginians at certain locations a couple of weeks ago, and Walgreens will start later this week. In addition, Walmart, Albertsons, which owns Safeway, KVAT, which owns Food City, RBS, which owns Giant, and a network of independent community pharmacies are all coming on board to start vaccinating eligible Virginians. They'll share a federal allotment of the Moderna and Pfizer vaccines. Now, not all of the locations for each of these companies will be receiving vaccines. Locations are decided by the companies in consultation with our Virginia Department of Health to focus these efforts on high-risk and vulnerable communities. And Walmart plans to hold vaccination clinics at off-site locations that our health department and Department of Emergency Management help to choose. So Walmart won't be vaccinating in its stores at all. So please don't go there looking for a shot. They'll be out at community sites. The great thing about this is off-site mass clinics will allow Walmart to vaccinate a few hundred people a day. And it will allow them to choose different locations each week based on need. All of these pharmacies will prioritize those 65 and over. And all vaccinations are by appointment only. So again, please don't just show up, but go onto our website or make the phone calls and make sure everybody can get registered. A couple of weeks ago, CVS became the first pharmacy in the federal partnership to start vaccinating in Virginia. We've had conversations with these additional pharmacies about working with our pre-registration system, and they're all willing and interested in working together. But there are still some technology barriers. Some pharmacies are able to work with our pre-registration system online, but others are not. So we're putting creative solutions in place. This week, the call center is making outbound calls to schedule appointments for Walmart and Giant. Call center workers are calling people in Virginia's pre-registration database. So when your phone rings, you need to please answer it. We expect to expand this effort next week and beyond, with the call center setting up appointments for other pharmacies using the VDH pre-registration database. We're also working to connect these pharmacies with the state's list. We're encouraging health districts to share their wait list database with the pharmacies. These partnerships are expanding very quickly, and the majority of pharmacies in this federal partnership will work with our system, and that's a good thing. We're doing everything we can to ensure that Virginians who signed up with the VDH list are in line for pharmacy appointments. I'm glad that these pharmacy chains are willing to work with us, and I'm grateful that this federal partnership puts an additional 52,000 vaccine doses per week into Virginia's arms. We're also grateful this week to the Federal Emergency Management Agency, or FEMA, which is allocating $179 million to Virginia to help cover costs to identify and set up future mass vaccination sites. We're not currently hosting those sites, but we don't want to wait until we have enough vaccine supply to do so to start the planning. We will be ready as supply expands. But we do expect to see vaccine supply increase soon, in part because, as you all probably heard on the news, Johnson & Johnson vaccine is likely to get approval from the FDA. Just this morning, FDA staff confirmed that the vaccine is safe, and we could see doses come into states as soon as next week. That is great news, because that will allow us to vaccinate more people and get closer to, as you all have heard us talk about before, herd immunity. So starting next week, just to summarize, we'll have 3 vaccines in Virginia that are safe and effective: Johnson & Johnson, Moderna, and Pfizer. All of these vaccines are shown to reduce serious illness and death from the virus. People ask me, what's the best one to get? Well, I would sum that up by saying the best vaccine is the one you get. Now, I'd like to talk about trends that are making it possible to ease some of the mitigation measures that are now in place. Last year, to slow the spread of the virus, we put limits on how many people could be together at various events or in certain places of business. And it worked. As our COVID cases and hospitalizations went down, we slowly raised those limits through phased reopenings. But as the cold weather and holidays approached, cases started getting higher than ever before. So we took the sensible step and reintroduced some of those mitigation measures. Limits on social gatherings and a curfew, for example. Now, almost 2 months past Christmas, and with thousands of Virginians vaccinated, we're finally seeing COVID numbers fall and vaccination numbers rise. That means we can start to consider how to slowly, safely ease some of the measures we put in place before the holidays. So here's what that will look like starting this Monday on March the 1st. We're going to expand alcohol sales to midnight. As you know, previously they were to close at 10, so that will go to midnight. And we will modify stay-at-home order will be lifted. So no more curfew from 12 to 5, but I still would encourage folks after midnight to please be at home. We're able to ease restrictions on outdoor gatherings. Outdoor social gatherings can have up to 25 people, up from the current 10. At outdoor entertainment and public amusement venues, the limit will move from 250 people to 30%, with a cap of 1,000 people. Now, if the trends continue as they are, cases down and vaccinations up, I would expect that by April, we could be able to continue the 30% measure, but remove the 1,000-person cap for outdoor venues. We will be working with venues to strengthen their ability to implement safety measures. And we hope that with trends continuing as they are, that we can look at further steps in the coming months. But it's critical that we do this slowly and thoughtfully. Monday, as you all know, is March the 1st. It will be just 6 days shy of a year since the first positive COVID case was identified in Virginia. And we have come a long way since then through a very, very tough time. And we do not want to risk our progress by easing restrictions too quickly. Not now, when more and more Virginians are getting the protection of vaccines, and not when variants that can infect more people more quickly are spreading. We're at a dangerous but very hopeful moment, hoping that we can spread vaccinations faster than the variants, and I believe that we can. For now, everyone needs to continue doing the things that we know work: social distancing, wearing a mask, and washing your hands. Finally, while we have focused on COVID and vaccines, the General Assembly is wrapping up its final week of session. Together, we have made important progress on major issues: ending the death penalty, getting children back into the classrooms, expanding voting access, legalizing marijuana, and much, much more. I appreciate the work that the legislators have done, and I look forward to reviewing the legislation that they approved when it gets to my desk. So thank you, and I'll be glad to take your questions. Henry?
Caught me off guard.
That's all right. Take your time.
On the federal partnership with the pharmacies, I mean, is the complicating factor there that you are dealing with a commercial partner and you can't really dictate to them, because there just seems to be so much confusion right now? Because I mean, I know you said Walgreens is supposed to be rolling out later this week, but I think some actually open today. I mean, what do you say to Virginians who are just confused right now?
Yeah, it's a great question, and we have been working diligently to get it as smooth as we can and least confusion as we can. I'm going to, Dr. Avula, if you just want to address it. He's been working with the different pharmacies, and to your point, there are now 8 different pharmacies. And anyway, before Danny gets you, I just want to commend him and his team. They have really been doing everything that they can to make this as straightforward as we can. But Danny, thank you.
So the question is, with the new Part 2 of the retail pharmacy, how is it working, and how are we just trying to streamline people's access to those pharmacies? And I'll first say that I can't say enough good things about Dr. Stephanie Weewell, our state pharmacist, and the work that she's done to work out all of these different arrangements with a lot of different pharmacy partners. Our goal and our intent absolutely is to continue to prioritize the 65 and up population across all pharmacies. We know that is our highest risk population in 1B and want to get as much access to vaccine as we can. And then also to honor the pre-registration process, right? The list that people have signed up for and been placed on. And so all of this has moved incredibly fast. You know, we find out last week from the White House, that this is opening up. We have 24 hours to determine who those pharmacy partners are. We executed those arrangements and have been over the last few days ironing out the logistics of how you actually get from a pre-registration list to an appointment with a pharmacy. The good news is that all of those new pharmacies have said we are absolutely willing to work. Not all, but most of those pharmacies are willing to work off of those lists. That's happening through a few different ways. So Dr. Weewell really, just to not slow vaccination at all, said go ahead and use your appointments, focus on the 65 and up, but just do that for the first few days. And as we have the local health departments curate their pre-registry lists, and then either the call center, as you heard earlier, is doing some outbound calling to fill some of those appointments. Local health departments themselves are staffing up to fill some of those appointments. And then in some cases, the pharmacies themselves are calling off of that list to fill some of those appointments. So I think a few days from now, we're really going to be able to make sure that those pre-registration lists are honored, and that's filtering into pharmacy appointments across the state.
Hi, Governor. Thank you for taking our questions. It seems that the pandemic and the vaccine rollout in part seems like it stretched local health departments, in particular in Western Tidewater and the Crater Health District. Several local health departments have either been closed long-term or been limited in services. and cited funding issues in part of that. What is being done to make sure that the local health departments, have the needed resources as these vaccines continue to roll out so that they can stay open? And then second, even with the improvement in cases and hospitalizations that you outlined, several hospitals in Southeast Virginia have been at or near their ICU capacities for several weeks, and that's with expanded capacities at that. What's your level of concern with this, especially with the virus's variants, making inroads, and then, also in announcing the relaxed restrictions?
Yeah, great. Two different questions, and I think one, Dr. Oliver can address our health departments, and then as far as our ICUs, I'll let Dr. Carey address that. So, Dr. Oliver, thanks.
So the question was about certain districts in the south side of Virginia, Crater Health District, Western Tidewater, and others who may have some challenges, as the reporter mentioned, in meeting their vaccination goals. The Virginia Emergency Support Team, the whole of government approach that we have to conducting this campaign, is very much aware of trying to provide resources in terms of personnel and logistics, project management, and other things to these districts. I actually think Dr. Avula could speak more specifically to some of the plans that are coming up this coming week, for example, with increasing the number of vaccination sites in the Crater Health District, and we have plans afoot to provide even more support in the coming weeks.
So I first want to say that some of these local health districts have just been doing amazing work for a year, right? I mean, when we think about building up the infrastructure for contact tracing and case investigation, for testing, for providing support for their local governments, there's never been a time in history where local public health has been demanded so much of. And so those districts really have done incredible work for this last year. And now we're at a stage where we're having to scale up for mass vaccination. We do recognize we need to bring along additional resources. And so we've done that through the VEST, through the state supports that VDEM and others. We are augmenting the vaccination capacity. So for the example, this coming week in Petersburg, there will be a 2,000 person vaccination event to come alongside the many pods per week that the Crater Health District is already doing. So we are monitoring that data week in, week out. We're identifying the districts that need that additional support. And then we are channeling resources, whether they are outside contracted support or finding other partners, pharmacies, and other providers. And we're making sure that vaccine gets to those communities where we've seen lower vaccination rates. And what we'll have to monitor moving forward is it simply an issue of supply, not enough vaccine getting out there, and capacity, or are there some districts where we're just going to see lower uptake rates because of lower demand? And so we'll start to monitor district by district what those uptake rates look like and what the distribution, the demographics of vaccination in those communities will look like as well.
Good morning, Governor. The question really is around the ICU capacity, especially in Tidewater, south side of Tidewater. And you are correct that Tidewater is where the highest region in terms of the new infections per day. Today they're right around 29 new infections per day per 100,000, whereas the average for Virginia is right at 23. In some areas like far southwest Virginia are down almost to 10 at 11.8. So that's good news. Each region is falling, and we look every day on a regional basis. What are those ICU admissions and capacity per each district? And it is falling in every region of Virginia, which is very good news. But in some regions, in this case, Tidewater, they're still being stressed. There's no doubt about that. But if you look at the total across Virginia, there's been a 48% reduction in the 7-day moving average of hospitalization since the peak of the 17th or 18th of January. So that is very, very good news, but it's not even. And we know that a lot of our health systems and our nurses and our doctors and our all of the teams that are working are still stressed. And also, frankly, there has been some deferred other illnesses that folks have not sought out. And the good news is that increasingly they're seeking out care for other conditions, and sometimes that does require ICU use. So the ICU utilization is still up for cardiac surgery, for neurosurgery, for complex abdominal surgery, and other conditions. So we know that our healthcare system is still being stressed, and also that workforce has been stressed for a year, just like our local health departments that Dr. Avula mentioned. But we could say the same about our teachers and our child care workers. We all want to get this behind us, and the way to get there is exactly what the governor said: physical distancing, wearing face masks, hand hygiene, and get vaccinated when it's your turn, and we will get this pandemic behind us.